Today's video, we are going over how to properly assess if your pelvic floor is working well. My name is Dawne. I work at Performance Place Sports Care, and we're going to get right into just a simple and easy way, but in different positions, to check if that pelvic floor is working properly. The easiest way, in my opinion, to really get it, to test it, one, but also to get people to really feel it, is by laying on your back here, okay? I do want to credit Dr. Lindsay Muma for this. She's the one who taught me this specific assessment, and I think it's really, really easy to teach other people. So laying on your back here, the first and foremost thing is we're actually using our breath to see if that pelvic floor is functioning. At home, who should be doing this? Anybody who's dealing with some low back discomfort, maybe pain that kind of radiates into the glutes, or just feel like you have some discomfort in your back when you were going from sitting to standing or trying exercises. Anybody with groin and hip impingement like symptoms, anything bringing your knee to your chest there when you have that pinchy sensation, this is a really good assessment for you as well. Postpartum moms, diastasis recti, if you're dealing with some of those things, this is a really good starting place for you to get back into your rehab routine and your exercise routine. So coming back to the assessment here, laying on your back, finding a neutral pelvis and neutral spine is going to be the first part here, okay? There is pelvic tilting, I'm sure that a lot of you have seen on YouTube, that we're going to be playing with. But your rib cage position plays a role as well, because to find the pelvic floor, you have to have a properly functioning diaphragm. And if you want to know a little bit more about that, we're not getting into it in this video. Go ahead and check out some of the other long format videos for that one. So what we're doing is we're going to rock our pelvis back and forth, kind of creating a tunnel here and then getting rid of that tunnel a bit and finding somewhere in between those 2 points where your back doesn't feel like it's squishing into the floor here, but you kind of have that just nice natural curve and it feels comfortable for you. But then we're going to come to the rib cage here, okay? We don't want that sticking way up to the ceiling like this, and we don't want you crunching your head up to take a peek at your belly as well. We want you flat. We want your ribs tucked down into your front pockets really lightly. It shouldn't be a whole lot of effort. You should be able to talk and breathe through it. So now that we're in this position, if you have really long arms, what we're going to do is we're going to reach to see if we can touch our butt bones, okay? Some people are able to do that. What we want you to do if you're doing this version here is to find the butt bones near the palm of your hand so that when you curl your fingers into the pelvic floor area, you can feel if there's movement there. But if you're like me with short arms, what we're going to do is we're going to just take one hand, we're going to reach into between the legs here, hand all across the pelvic floor, and we're just going to start breathing deep into the hand, okay? Some people, it takes a really long time for you to feel what's happening down there. What you might need to do is take deeper breaths, take a little bit more time to see if you can direct the breath down there, or even a little extra pressure with your hand can get you to feel it better if you just don't know yet what you're supposed to be feeling. You're gonna feel movement into the hand, that's what we're looking for. So in this position, we're gonna take a couple breaths in and out of the nose, nice and easy with your neutral position. Okay. Again, feeling for any really just light resistance that's dropping down into the hand there, okay? This position here usually is the easiest way to get people to feel it, okay? A progression to this is actually a seated position. I usually would show this in the chair so that your legs and your knees are at 90 degrees and your feet are flat, but I'm on the floor here, so we're just gonna show another version seated. Again, you can sit on your hands, find your butt bones, sit up tall, find that neutral pelvis, find the neutral rib cage, and just start to breathe into your hands and into the floor here. But if you can't reach that direction, sitting on the hand, giving yourself a little pressure into the pelvic floor there, tall spine, take a couple breaths. And it really, all it feels like is just a very light downward movement, something pressing into your hand a little bit more than just your body sitting on it, okay? So that there is a quick and easy way for you to assess if the pelvic floor is working properly. If you're having a really hard time at home figuring that out, again, play with your position. If it just seems too nuanced, not sure what you're supposed to be feeling, please reach out to us. We can help you virtually in person. We can talk about if the pelvic floor is something that you need to be focusing on for your injuries and symptoms.